Hello, my name is Dr. Patel. I'm a GP registrar currently working in Laxey and Village Walk Health Centre. I've put this video together to give you more information about a condition called prediabetes. In order to understand what prediabetes is, we must understand what diabetes is. So in this video, I'll be explaining what exactly diabetes is, how this relates to prediabetes, and some of the things we can do in order to prevent the progression of prediabetes onto diabetes. So stay tuned. Diabetes is a condition that is diagnosed when the body has lost its ability to control the blood sugar level. What's the dangers of this? So we have known for many years that in an individual where there is poor control over blood sugar level over months and years, this will lead on to problems with the heart, this will lead on to problems with the kidneys, and problems with the circulation and nerves in the legs, okay? On the other hand, prediabetes is when the body is struggling to maintain a good control over the sugar level, okay? The significance of this is that in individuals who are pre-diabetic, if no lifestyle changes are made, we know that they will most likely go on to develop diabetes in months or years. This is something we want to avoid at all costs. Research has shown that in those who are already diabetic, it's a lot more difficult to revert back to a normal state of sugar control. On the flip side, those who are pre-diabetic, research has shown that the body does respond better when making some lifestyle changes. So it should be easier in theory to revert back to a normal state of sugar control. So that's why it's important to make changes now. Diagnosing prediabetes and diabetes is relatively easy. We use a blood test called HbA1c. You might have come across this blood test when looking on Patient Access. And the chances are you're probably watching this video because we've measured your HbA1c. It's come back in the pre-diabetic range, and a member of staff has directed you to this video. So the time has come in this video where we can focus on what changes we should be making. So here we go. In respect to prediabetes, improvements on our diet has two main aims. The first one being weight loss. Studies have shown a correlation between losing weight and improving sugar control. The second aim being to choose the right foods and eating habits to lower average daily sugar level, as demonstrated by the green line. The glycemic index of a food refers to how fast it releases its energy into the bloodstream. Sugary foods release the energy quickly and are known to have a high glycemic index. Low glycemic index foods release the energy slower, preventing a spike in the sugar level. Foods that we do not typically expect also have a high glycemic index, such as white rice, white pasta, potatoes, and white bread. It's surprising to see how much sugar there is in certain fruits and smoothies, so it's best to limit these. We should aim to consume low glycemic index foods to give a gentler release of energy throughout the day. Do a search on low glycemic index foods to see which ones you like. Portion control limits our calorie intake, which makes weight loss more likely. Limiting carbohydrates also encourages weight loss. So it's important to limit portion size of common foods like potatoes, bread, pasta, and rice. The main purpose of exercise is to burn more calories to lose weight, which in turn will improve sugar control. If you do not manage to lose weight, do not be disheartened, as regular exercise helps you improve sugar control anyways. National guidelines advise taking up 150 minutes of moderate intensity exercise per week. This is equivalent to 30 minutes of exercise 5 out of 7 days in a week. You should aim to break a sweat. A brisk walk or a gentle jog will do just that. Remember, alcohol beverages are generally high in calories. Drinking excessively will hinder weight loss. Men and women are advised not to drink more than 14 units of alcohol a week on a regular basis. Spread your drinking over 3 or more days if you regularly drink as much as 14 units a week. Try to have regular alcohol-free days to prevent a habit developing. Smoking not only raises your blood sugar level but also contributes to clogging up your arteries, resulting in issues with your heart, kidneys, and circulation in the legs. If you are thinking of stopping, Quit for You is the island's organization which helps you quit. In summary, the main aim is to improve diet and take up regular exercise. We should also focus on cutting down alcohol and stopping smoking. If you would like more information, please book an appointment with the practice nurse. We can also refer you to Healthy for Life, an organization that can help you get into exercise. Please ask for more information.